Hi everybody, this is Dr. Garima Verma, your very own Dr. Scrubs, and today I have the pleasure to introduce my senior, Dr. Aditi Singh. She is currently pursuing MD Microbiology from UCMS Delhi. Hi doctor, how are you?
Hi, I'm good. What about you?
I am good too, ma'am. Just thank you for taking out time for us from your busy schedule for this session. Just tell a little bit about your life, like how is life and how is residency treating you?
Life is good, and residency is like it's residency, so
Correct.
it's good and bad both, but mostly good.
Okay. Tell us what a day in your life looks like. What is the work that you do in the hospital and when do you get free and everything. We like mini tour the अपनी life का.
Okay, chalo. Mostly like I get to work at 9. Okay,
Okay.
by 9 we have to reach the department.
Hmm.
Then we start the morning reporting. Okay, we see the slides, we see the smears, we see the plating and all everything. We give the report to our clinicians and all. Then we have to go to the hospital, like we have to go to the wards, and we have to talk to our clinicians regarding the reporting and patient treatment. Like we have to manage the infection control and antimicrobial stewardship
Okay.
programs. So we go there, we tell our clinicians that like put the patient on this or
Okay.
remove the patient from this. Like we have to do that. Then we come back. Then we have our seminars, journals. Then we go for like MBBS ka micro teachings and all. Then evening may we do the second round of reporting, and then by 4 or 5 we get free.
And
It's basic.
उसके बाद do you get to report to the hospital any emergency duties or anything that you have?
Uh, See, currently in my hospital, we are not doing night duties, but that's not the rule. Okay,
Okay.
in microbiology, like, okay, we get it that we hear, okay, it's microbiology, it's chill out life, easy life. But technically, for the betterment of the patient and to maintain the hospital ka wo, ideally we should have night postings. We do have night postings, but only our technical staff goes at the night. But in other
Okay.
hospitals, yeah, we get to have night postings as well, emergency duties.
Okay.
So, but currently we are not doing it.
So is there any patient interaction in your branch?
Yes, see, ideally we are supposed to, okay, like, okay, we get it that it's microbiology, but it's not actually microbiology, it's clinical microbiology. We
Exactly.
are supposed to be in connection with the clinical side of our branch. Okay, without our help, the clinicians won't know what antibiotics to prescribe to the patient.
Correct.
So ideally, we are supposed to like look at the patient, see the patient ka clinical matlab, signs and symptoms, and accordingly, we are supposed to advise the treatment.
Okay.
So yeah, we are supposed to do that.
But do we do that?
Normally, see, like in hospitals like AIMS, JIPMER, okay, it is advised, and they do it on a regular basis. We, on the other hand, like at my hospital, we talk to our clinicians first
Okay.
and we take history from them.
Okay.
But yeah, without that, we won't be able to prescribe what's good
Exactly.
for our patients.
So you are in direct contact with other postgraduates, other residents about the patient. You directly don't take histories from the patient, right?
Yeah, we don't take patient directly from the patients, but yeah, we take the histories from our clinicians
Okay.
on a regular basis. We are supposed to do that.
So it varies from college to college, right?
Yes, it varies from college to college, but ideally you are supposed to be like
Okay.
actually ideally though you are supposed to be there when the rounds happen in the
Correct.
wards. Okay.
Hmm.
So along with the clinician, the microbiologist is supposed to be there.
Okay. Correct. Because
Yeah,
otherwise, how will you guys know ki what treatment patient is on, right?
exactly.
Correct. Ma'am, why did you choose this branch and what are the alternatives? What were the alternatives you had in your mind?
You see, uh, frankly speaking, MD microbiology is not I'll say just it's not the first option for anyone. Okay.
Correct.
like people tend to ignore ki acha okay, it's microbiology, yaar, we want to be in like uh, seeing the patients on a daily basis and doing everything like that's like they prefer that, like
Correct.
that's the real doctor. Okay, MD microbiology is not everyone's first choice.
Correct.
So likewise mine was also pediatrics was my first choice,
Okay.
but things happen, okay, and then you have to settle. Okay,
Correct.
but you have to like have interest in microbiology to be in this field. Okay,
Okay.
otherwise you will get bored, otherwise you will feel like life is monotonous and it's not going anywhere. Plus it's a very very volatile subject.
Correct.
Okay, like if you read as many times as you read microbiology, you'll tend to forget it.
Correct.
Okay, you'll have to be in constant touch with this subject. So you have to have some interest in this field, otherwise you won't survive.
Okay. So, how is the transition for you from MBBS to MD? Like MBBS time पे second prof में we used to hate microbiology so much because it is that volatile. तुम कितना भी पढ़ लो end में तुम्हें कुछ याद नहीं आएगा.
Exactly. See, MBBS में ना हम लोग को we just get a gist of everything, right?
Correct.
हमें नहीं पता था, हमें लगता है कि MD माइक्रो वाले करते क्या है, ये सब लैब में
हाँ
बैठते
लैब में
हैं, they
बैठते
just
हैं.
ठीक है, and they just come sit for some time and then they leave.
Correct.
ठीक है, ऐसा होता नहीं है. ठीक है, like okay, for example, किसी भी हॉस्पिटल में if you go, okay, you know what is infection control, right?
Correct.
So infection control ka the head is a microbiologist.
Okay.
It's their responsibility, ठीक है, to keep the infection below 5% in every hospital.
Okay.
So they have to maintain that. Then you know, like you very well know that antibiotic resistance is increasing, okay, worldwide, even in our country.
Yes.
Okay, so it's a microbiologist's responsibility to maintain the microbial stewardship program.
Okay.
ठीक है, तुम कैसे भी किसी भी तरह से ना ऐसे you can't prescribe anything to the patient. You have to be vigilant prescribing the antibiotics. So yeah, it's a microbiologist's job.
Okay. So MBBS to MD transition is too much, I feel.
It's not too much. You'll get used to it. Obviously, it's starting where it takes time, but yeah, eventually you get used to it and you fell in love with the subject.
Okay. So are you happy with the choice that you made?
Yes, I am.
But if today I give you an option to change the branch, would you do that?
No, I don't think so. I'll do that.
So you are very well settled in this branch and you're happy.
Yes, I am.
Correct.
I get like professional and personal life balance is there in this
Yes.
branch. So yeah, I like it.
Correct. So, ma'am, what do you have to say about the opportunities after MD microbiology?
Okay, so like there are a lot of opportunities. Okay, like we have seen post-COVID, pre-COVID, though people didn't consider microbiology as a like a very good branch. Or okay, I'll just frankly say that. But post-COVID, we have seen the importance of microbiology,
Correct.
right? So, okay, microbiology mein you have very many options. First is academics. Okay, we all know.
Correct.
You can be a assistant professor, then associate professor, then professors. ठीक है, वो सब है. And then you have private hospitals में, ठीक है, you can be consultants.
Okay.
ठीक है, then you can run your own lab. Private labs में everyone needs a microbiologist. Without a microbiologist, you can't sign a culture report.
Correct.
ठीक है, so you can work as part time of full time microbiologist there. Then you have very many fellowships programs, okay, in India as well as outside. Okay, you can go in those fellowships program. Then research is like, you know, post-COVID, everyone knows. Okay. Then, so the next is DM. Okay. So you can do DM in DM virology and DM infectious disease. Okay. So currently in India, DM infectious disease, two institutes are there that offer this DM course.
Correct.
First is AIMS New Delhi. The second is AIMS Jodhpur. Okay. So इसके अलावा like every hospital needs a proper infection control program, ठीक है? So you can work there as infection control in charge, ठीक है?
Correct.
So yeah, there are many other, मतलब many options for a microbiologist.
Correct. Because usually we don't hear about MD microbiology so much ना. Like धीरे धीरे MD path के बारे में we have heard कि pathologist की importance क्या है, but nobody knows what is the importance of a microbiologist. Like I did not know
Right.
about it कि hospital में infection control के लिए you need a microbiologist.
Exactly.
Yeah.
See, like India में still there is not that much respect for a microbiologist,
Hmm.
let's say. But India के बाहर, ठीक है? You can't prescribe any antibiotic without the signature of a microbiologist.
Okay.
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 Like due to this antimicrobial resistance, ठीक है, increasing day by day, you are not allowed, like a clinician won't be able to prescribe any antibiotic, any treatment whatsoever without the signature of a microbiologist, without the permission from a microbiologist.
Okay.
So yeah, like they know the importance.
Okay.
And yeah, India is starting to recognize the
Yes,
importance of a
post COVID things
microbiologist.
have changed. Like earlier, people did
Yes.
not even consider anesthesia or critical care, and after COVID, like there is a huge demand.
Exactly.
There's a huge demand for the critical care resident and microbiologist because of all the research, and we have learned the importance of critical care.
Exactly. Like, for example, people before COVID, they didn't know what a rapid test was, what an
Yes,
RT-PCR
RT-PCR
was.
was.
Okay. Post-COVID, they are recognizing, okay, oh, this happens. Oh, a microbiologist does this. Okay.
Correct,
It's
correct.
like, yeah.
So, do you get time for yourself, and is there any toxicity in your department?
So, okay, frankly, there is no toxicity in my department. Like, thank God to that. Okay, like my consultants, even my seniors and my juniors, everyone is nice. Okay, but generally there is we hear that like there are toxic departments. Okay, but it's because they are working like 42 to 72 hours. So it happens. It generally happens. But yeah, you can say ki there is less toxicity in microbiology.
Okay.
Okay, and yeah, I do get time for myself. Like after 4, 5, I am free. Like I can tend to other works. I can do whatever I want. And yeah, you have to study also, but yeah.
Okay, suppose somebody who has dropped for more than an year now and wants to settle in a branch and not getting a branch of his or her choice, would you advise कि micro लेके he can settle?
Yeah, definitely they can settle, but वही है at the end, like you have to have a little bit of interest in microbiology. ऐसा नहीं होगा कि like तुम्हें MBBS में अगर वो branch कभी पसंद ही नहीं आया and you would be able to settle for it, because like I said, it's a very volatile subject. ठीक है, and you might get frustrated, but like if you like the subject, ठीक है, and if you are interested in like knowing things, getting to know new things, ठीक
Correct.
है, then yeah, it's a good branch.
Okay. So,
Like if you do not want to drop for it.
okay. So, any specific tips for somebody who's waiting for counseling?
See, always go with the first choice, like work hard, however you can, whatever you can, go for the best, whatever you want. But like in any case, if you don't get it, don't get into the dream branch of your choice, don't be heartless. Just like try to look for other options, and if you think you can go with the other options, then definitely go for it.
Correct. Because life does not stop for an exam. That's
Yeah.
what I feel.
See, PG is like something कि आप कर लो, ठीक है, इट्स लाइक आप किसी भी ब्रांच से करो, क्योंकि पीजी के बाद लाइफ खत्म नहीं होती, उसके बाद शुरू
शुरू
होती है,
होती है.
ठीक है. You have to find jobs, you have to look for options, ठीक है, and competition, trust me, is very tough,
Correct.
and we don't have that many jobs in our country. Okay. So yeah, like go for it.
Okay, so my last question. When you were preparing for NEET, what was the source that you used and who was your favorite faculty?
Okay. So I was using Prep Ladder.
Okay,
Okay. And there is this teacher, Dr. Prasanvich, in
in
gynecology,
gynecology.
obstetric gynecology.
Correct.
Oh, he is an amazing person. I mean, the way he teaches, it's very good. So yeah, he was good. And then GRG sir तो हैं ही भाई
GRG,
फार्मा के
Lord
लिए
GRG.
उनके बिना तो फार्मा होती नहीं.
Correct, correct. So, thank you for taking out time for us and doing this session because people don't know what a microbiologist does. So, I was thinking ki will enlighten people ki MD microbiology is a good option too. If you are looking for some settlement and you're tired of dropping and you're not getting your dream branch, then you can also consider, if not path, then microbio too.
Yes, definitely. Like, and it's not like you won't get jobs. Like, there are very many options post MD.
Correct.
So yeah, it's a good branch.
Okay, thank